Greetings, fellow healthcare enthusiasts, and welcome back to Wally's Nursing Videos. Today, we're diving into the fascinating world of the gastrointestinal GI system, a dynamic network of organs crucial for digestion, absorption, and overall well-being. But before we embark on our exploration of diagnostic studies, let's kick things off with a basic overview of the gastrointestinal system. Overview of the gastrointestinal system. Here at Wally's Nursing Videos, we believe that a solid understanding of the basics sets the stage for deeper insights. So, grab your virtual stethoscopes as we delve into the incredible journey of the GI system. 1. Mouth and salivary glands. Imagine this as our system's grand entrance. In the mouth, chewing commences the mechanical breakdown of food, while salivary glands release enzymes for that initial chemical dance. 2. Esophagus. Our muscular maestro, the esophagus, conducts a symphony of peristaltic movements, orchestrating the journey of food from mouth to stomach. 3. Stomach. Welcome to the gastronomic arena. The stomach, our culinary powerhouse, breaks down food with gastric juices and kickstarts the protein digestion party. Small intestine. The small intestine takes center stage for nutrient absorption. Think of it as the VIP section where carbohydrates, proteins, fats, and more get the red carpet treatment. 5. Liver and gallbladder. Enter the hepatic maestro, the liver, producing bile for fat digestion. The gallbladder plays the supporting role, releasing bile when needed. 6. Pancreas. Meet the pancreatic multitasker, secreting enzymes into the small intestine for the digestion of carbohydrates, proteins, and fats. 7. Large intestine, colon. Our grand finale unfolds in the colon, where water and electrolytes are absorbed and feces take their final form before the curtain falls on waste elimination. Now that we've refreshed our knowledge of the GI system, let's roll up our sleeves and dive into the diagnostic studies that help us unravel the mysteries within. Stay tuned, because at Wally's Nursing Videos, we're not just learning, we're on a mission to make healthcare knowledge accessible and engaging. Diagnostic studies of GI system, unveiling the inner workings. Radiology. Radiology, our first player in the diagnostic orchestra, utilizes X-rays to reveal the inner structures of the GI system. Angiography. Angiography steps onto the stage, capturing detailed X-ray images of blood vessels in the GI system, providing insights into blood flow and potential abnormalities. Endoscopy. Enter endoscopy, a versatile tool combining a flexible tube with a camera to visually explore the esophagus, stomach, and duodenum. Ultrasonography. Ultrasonography, like a sonar for the body, uses sound waves to create images, helping visualize organs such as the liver, gallbladder, and pancreas. Nuclear imaging scan. The nuclear imaging scan adds a touch of sophistication, utilizing radioactive substances to create detailed images, particularly useful in detecting disorders in the liver and biliary tract. CAT scan, CT. CT scans, our next spotlight, provide detailed cross-sectional images, focusing on the biliary tract, liver, and pancreatic disorders. Barium enema. Moving on to specific studies, the barium enema steals the limelight. This procedure enhances radiographic visualization of the large intestine. But remember, preparation is key. Clear liquids, NPO the night before, and bowel cleansing. After the test, expel the barium, drink fluids, and anticipate chalky white stools for 24 to 72 hours. Upper gastrointestinal, UGI series, and small bowel series. These studies examine the upper GI tract. Before the test, maintain NPO, withhold analgesics and anticholinergics, and brace for a barium drink. Post-test, hydrate, administer laxatives or stool softeners, and be vigilant for signs of perforation, especially sudden temperature spikes. Lower gastrointestine series. Shifting our focus to the lower GI tract, this series examines the lower small intestine and colon. NPO, laxatives, enema, and ensuring a clear colon are prerequisites. Post-test, hydrate, administer laxatives or stool softeners, and keenly watch for rectal bleeding, a potential sign of perforation. Oral cholecystogram, GB series. This X-ray examination peers into the gallbladder's secrets, assessing patency and determining iodine sensitivity. Dye administration, NPO post-dye, and maybe a creamy drink. That's the drill. Angiography, cholangiogram, PTC. This procedure sheds light on the biliary duct system or liver. PrEP includes laxatives, NPO, and coagulation tests. Post-test, bed rest, local anesthesia, and vigilant assessment follow. Computerized tomography, CT. CT, a non-invasive axial tomography, works its magic especially in detecting biliary tract, liver, and pancreatic disorders. No special prep, just a bit of teaching. Magnetic resonance imaging, MRI. MRI takes the stage, using radio frequency waves and magnetic fields to detect hepatic metastases and sources of bleeding. NPO, metal implant checks and pregnancy assurances precede the show. Endoscopic retrograde cholangiopancreatography, ERCP. ERCP, a dynamic duo of endoscopy and fluoroscopy, plays a starring role in diagnosing and treating liver, biliary, or pancreatic ductal issues. Highly skilled gastroenterologists perform it with careful NPO preparation, intravenous sedation, and post-test assessments. Magnetic resonance cholangiopancreatography, MRCP. MRCP, a safer alternative to ERCP, hones in on diagnostic imaging. NPO, contraindication checks and dye considerations are part of the preparation. Esophago-gastroduodenoscopy. Visual exploration of the esophagus, stomach, and duodenum unfolds with esophago-gastroduodenoscopy. NPO prep, conscious sedation, and post-test monitoring ensure a smooth performance. Colonoscopy. Our endoscopic journey continues into the entire large bowel with colonoscopy. Liquid diet, NPO, bowel cleansing, and vigilant monitoring are the backstage rituals. Gastric analysis. Gastric analysis takes us into the world of hydrochloric acid and pepsin measurement. NPO, nasogastric tube insertion, and pre-test abstinence from certain drugs and smoking set the scene. Fecal analysis. Stool analysis unveils a wealth of information. Dietary restrictions precede the collection, with orders ranging from occult blood to culture and sensitivity. Closed liver biopsy. Our grand finale, the closed liver biopsy, is an invasive procedure demanding consent, coagulation checks, and baseline vital signs. Post-procedure, vigilant monitoring, pressure dressing, and a day of bed rest ensure a smooth recovery. As we wrap up today's episode, remember, understanding these diagnostic studies equips us to provide holistic care to our patients. Stay tuned for more captivating insights on Wally's nursing videos. Until next time, keep exploring the wonders of healthcare with a curious mind.